Sediments in urine can be examined under a microscope to provide information about a possible kidney or a urinary tract disorder. That's why urine examination is called as poor man's biopsy. Normally, the urine consists of small number of cells and other debris shed from the inside of the urinary tract. A person who has a kidney or a urinary tract disorder usually shed these cells more when compared to a normal person, and these form a sediment if urine is centrifuged or allowed to settle. A variety of normal and abnormal cellular elements may be seen in the urine sediment. They are cells like RBC, WBC, epithelial cells, cas, crystals, and some other structures like spermatozoa in males, parasites, fungus, tumor cells, bacteria. Now, first coming to the RBCs. Hematuria is the presence of abnormal number of red blood cells in urine due to glomerular damage, kidney trauma, urinary tract stones, urinary tract infections, blood toxins, and also because of the physical stress. Red cells may also contaminate the urine from the vagina in menstruating women. Theoretically, there should be no red blood cells, but few find their way into the urine even in very healthy individuals. So 0 to 5 per high power fed is normal as per the studies. Coming to epithelial cells, these are the cells which are round to polygonal in round to oval in with small to large nucleus. Epithelial cells in the urine can be squamous epithelial cells, tubular cells, or transitional cells, or they can be from lower or the upper urinary tract simply. Significance. What is the significance of these epithelial cells? Formerly, few epithelial cells are seen in urine and they are more common in females and reflect normal sloughing of the cells. When these cells are present in large number along with WBCs, then they are indicative of inflammation. This is a picture showing the squamous cells in a urine sample. The nucleus and the cytoplasm which are showing the features of squamous cells. And this is a picture showing the tubular epithelial cells, round to oval with large central nucleus and abundant cytoplasm. And this is a picture showing few transitional cells, and this is one more picture of the transitional cells. You can appreciate the cells with nucleus and 1 to 2 nucleoli also seen. Now coming to the cas. Cas are cylindrical protein based molds of the nephron tubule which can then get flushed out into the urine. Cas can be made of different types of materials. White or red blood cells, waxy or fatty substances, or proteins. The type and makeup of cas can provide the clues about the type of kidney disease that may be present. The basic structure of a cast is tam horsewall protein, which is secreted by the tubular cells. Depending upon the content, these casts can be of various types. They are hyaline casts, RBC casts, leukocyte casts, granular casts, waxy casts, fatty casts, and epithelial casts. First, hyaline casts. Hyaline casts, these are the most frequently observed casts consisting almost totally of tam horsewall protein. 0 to 2 casts per lower power field is considered as normal. They are very transparent, cylindrical and colorless, seen in fever, dehydration, exercise, acute glomerulonephritis, malignant hypertension and congestive heart failure. This is a picture showing the hyaline cast, cylindrical, transparent. Coming to RBC casts, red cell casts or RBC casts are indicative of the bleeding within the nephrons. They are formed in the distal nephrons and they contain red blood cells and have a yellowish orange color. They are passed into the urine in conditions like lupus nephritis, IgA nephropathy, renal infarct, acute glomerulonephritis, and good pasture syndrome. This is a picture showing the red blood cells cast, how they are seen in a urine sample. You can appreciate the yellowish color and the round cells forming the cast. Leukocyte casts or WBC casts. These casts have granules and frequently show multilobated nuclei. WBCs enter the tubular lumina from the interstitium. WBC casts are passed into the urine in nephrotic syndrome, lupus nephritis, acute glomerulonephritis, acute pyelonephritis, interstitial nephritis. This is a picture showing WBC casts. Coming to granular casts. Granular casts have coarse granules in their basic matrix. Granules form from the degenerating cells or because of the solidification of the plasma proteins. These granular casts are passed into the urine in conditions like viral diseases, chronic lead poisoning, pyelonephritis, renal papillary necrosis. This is the picture showing the granular cast. Coarse granules is the characteristic feature of these granular casts. Waxy casts. These are yellowish, homogeneous with irregular blunt or cracked ends, and these have high refractive index. These are also called as renal failure casts or renal failure casts. These are passed into the urine in chronic renal failure, viral diseases, and renal transplant rejection. See, this is a picture showing waxy casts. They are yellowish, fatty casts. The name itself indicates the cast consists of fat. So there are fat globules of varying size which are highly refractile. Fat in the cast is cholesterol or triglycerides. Fatty casts are seen in fat necrosis and nephrotic syndrome. Epithelial casts. Epithelial casts contain shed of tubular epithelial cells and appear as two parallel rows of cells, sometimes difficult to differentiate from the WBC casts. And these epithelial casts are seen in acute tubular necrosis, heavy metal poisoning, and in renal transplant rejection. See the yellowishness. Coming to the crystals. Crystals are formed because of the precipitation of the urinary salts. Formation of the crystals depends upon the pH, temperature, and also concentration. Crystals suggest high concentration or altered solubility. Crystals in acidic urine, crystals in alkaline urine. First, crystals in acidic urine. Calcium oxalate, uric acid, amorphous urate, tyrosine, cysteine. Calcium oxalate crystals are colorless, refractile, and have octahedral envelope-like structures. They can also be in dumbbell shape. In the picture, you can see the envelope-shaped crystals representing the calcium oxalate. Uric acid crystals are yellow or brown in color, rhomboid shape, seen singly or in rosettes. They can also be seen in the form of prisms, plates, and sheaves. So, uric acid, rhomboid shape, they can be in prisms, plates, or sheaves or rosettes. Amorphous urate, they appear as yellowish grey granules in the form of clumps. They dissolve on heating when they are made up of sodium urate, and they are needle-like in the form of thorn apple. The sodium urate crystals are thorn apple-like. Remember this point. And these are passed often in patients having gout. Tyrosine crystals are yellowish and are in the form of silky needles or sheaves. They are passed into the urine in jaundice. 16. These are colorless hexagonal plates and are highly refractile. They are passed into the urine in cystinuria. Now coming to the crystals in alkaline urine. Amorphous phosphate, triple phosphate, calcium carbonate, ammonium biurate and sulfonamides. Amorphous phosphates. These are seen as amorphous granules in the form of clumps or irregular aggregates. They get dissolved when urine is made acidic. Triple phosphate. They are in the form of prisms and sometimes in the fern leaf pattern. They dissolve when urine is made acidic. These triple phosphate are also called as having the appearance of coffin lid appearance. Calcium carbonate. They are in the form of granules, spheres and rarely dumbbell shaped. They dissolve in acidic urine. Ammonium biurate. They are round or oval, yellowish brown spheres with thorns on surface, giving them thorn apple appearance. So, thorn apple appearance is seen in crystals of ammonium biurate. They dissolve on heating the urine or making it acidic. Sulfonamides. These are yellowish sheaves, rosettes are rounded with radial striations. In the picture you can see the striations. They appear in urine after administration of the sulfonamide drugs. By seeing the picture itself, everyone can identify the spermatozoa with head, body and tail. They can be seen in normal urine in males. They are motile. Bacteria. More than 10 power high power field is significant and majority of the bacteria are rod shaped. AFB, acid fast bacilli, can also be seen in urine. Yeasts. These are the most commonly found and because of the contamination and they are seen in candidiasis. Viral inclusions. These are seen in viral cystitis, cytomegalovirus infection. Parasites. Sometimes parasites can also be seen in the urine. Parasites that are seen in the urine are Trichomonas vaginalis in females, Schistosoma hematobium, Entamoeba histolytica. Tumor cells. Tumor cells can also be seen in the urine sample. They can be from the kidney, bladder or urethra. These cells are examined after staining the urine sediment. The stains that are used are Papanicola stain, Wright stain, immunoperoxidase stain and immunofluorescence stain. This is a beautiful picture showing the cells in squamous cell carcinoma urine sample. And this is a urine sediment stained showing renal cell carcinoma. Thank you for the patient listening.